Assalamualaikum warahmatullahi wabarakatuh. Here you go. We will continue to the second subtopic for the chapter 8, development for Bio 565. So, Alhamdulillah Rabbil Alamin, wassalatu wassalamu ala ashrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in. Alhamdulillah, all praises to Allah Subhanahu wa Ta'ala for giving us an opportunity to learn and to gain a new knowledge on those regarding the human reproduction. So previously, I have discussed for the first part, cleavage and implantation. So today, I would like to further my lecture on organogenesis, gestation and pregnancy, labor, lactation, and hormone. So stay tuned with me. So these are all those learning outcomes that you should be able to describe at the end of this lecture. So I want you to recall back about the gastrulation. Okay, once it can form 3 layers there, 3 layers of gastrulation, what we call as embryonic germ layers. So there are 3 layers, what we call as the outermost part, what we call ecto. Ecto means at the outermost, derms means the layer of it. Okay, so for ectoderm, it usually will form exoskeleton, means everything that are related to the skeletal. Second one, mesoderm, at the middle layer, what we call as filling the space between endoderm and ectoderm. So what we call as the middle layer. Ecto, outer, meso means middle, and we do have mesoderm that's usually will develops into organs of human. Then we do have endoderm that forms inner lining of the organs. Okay, what's organ? It lines the embryonic digestive tract. So this is closely related from gastrulation. It's going to be organogenesis. Organo means development into organ, right? Organ. So it's what we refer as organs formation. So genesis is stand for formation. Organo means organs. Genesis means the creation of formation. It arises from the layer that I have showed before, from gastrula space. Endoderm is to develop the gut or digestive system. Mesoderm to form an organ. Okay, organ types, whether it is muscle, circulatory system, or blood itself. And ectoderm will be forming a outermost layer of the organ, and it is associated for the skin formation and nervous system formation. So these are all those classification. What are the organ that are formed through these 3 layers? Here we go for the first, ectoderm. It can form epidermis, epithelial lining of mouth and rectum, sense receptor, cornea and lens of eye, nervous system, medulla, adrenal, tooth enamel, and then the epithelium of pineal and pituitary gland. Okay, for the mesoderm, it's mostly directly to the skeletal muscle system and the organ. Okay, organ itself is from the mesoderm. For example, skeletal system, muscular system, reproductive system, dermis of skin, adrenal cortex, circulatory and lymphatic system, reproductive system also. So then we do have the third one, the inner layer is lining for the digestive tract, and then lining of respiratory system, lining of urethra or urinary bladder. It also can form liver, pancreas, thymus, thyroid, and parathyroid glands. So we can see from those organogenesis means the gastrulation after it is divided into 3 layers, then we should know how's the development of placenta itself. Placenta actually is like one of source for nourishment to the baby. So placenta is one site for nutrient and gas exchange. Also for the waste itself, if the baby are forming the waste, it can exchange it through the placenta. And also the placenta can secrete hormones. For what? To maintain pregnancy and to avoid any abortion. Means whether it can, the uterine will going down and so on. So this is the placenta function. And then it can develop from embryonic chorion and maternal uterine tissue. Means there are combination of both. First one from the baby itself, okay, it's from the chorion of the baby, and then second from the uterine tissue, means the lining of the uterus of the mother. So both of these can develop placenta. So chorionic villi are formed from chorion and project into endometrium of the uterus. And then we do have also the umbilical cord. Okay, umbilical cord, what we call as tali pusat here. Okay, that also contain 2 umbilical arteries and 1 umbilical vein. 2 arteries and 1 vein that connect the embryo to the placenta. These are placenta. Okay, if it is only in the marginal part, the placenta looks very thick. And if it is all complete, the placenta, so the placenta directly become thin. Okay. We do have the second one. What are the embryo support systems? First one, they do contain the placenta, the one that we have discussed before. It is an organ, right? To form a wall of uterus where the fetus can receive. Okay, can receive oxygen, nutrients, and gas, and ways of get rid of waste products is through the what we call as simple diffusion. As diffusion, okay, diffusion means the exchange directly happen here. Diffuse through it. And then we do have second one, HCG, human human chorionic gonadotrophin. It is hormone that's secreted by the placenta and also can be detected in the pregnancy test. So this one is to maintain the secretion of hormone so that uterine wall can remain in its state and not abort. Okay, then the third one is umbilical cord. Okay, they are the tubes that connects the fetus to the placenta, from whether it is direct from diffusion or also to connection between the umbilical cord. And then we do have inside there what we call as amniotic fluid that surround the fetus that are developing in the uterus. Okay. So we continue again. What are the functions of placenta? It can form a barrier between mother and embryo, delivers nutrient and oxygen. It can remove waste from the embryonic blood and can become an endocrine organ, means and hormonal organs that can produce hormone, and it takes over from corpus luteum. Usually for the female, corpus luteum can produce or induce the production of hormone. So through in case of pregnancy, the hormones are mostly or majorly regulated by the placenta. So those hormones that are regulated by them are estrogen, progesterone, and other hormones like oxytocin, HCG, and so on. They are hormones that can maintain the pregnancy. So you can see how's the hormone level over the months of pregnancy. From the first month, the highest peak of hormone level at HCG, human chorionic gonadotropin. Okay, this is for the first trimester, 3 bulan pertama. And then the level of hormone of progesterone and estrogen will consistently increase until the level or rise at the most or the peak level during 8 to 9 months of pregnancy. Then we do have also another types of hormone like placenta lactogen. Okay. Okay, then we do have pregnant mare serum gonadotropin. Okay. So serum means the one that are present in the blood. Okay, in the blood. So for what the function of PMSG? Okay, function of PMSG is to stimulate the development of follicles and ovary due to FSH effects. Okay, so some of the follicle may ovulate. Most follicles become luteinized without ovulating due to low LH potency. Okay, so they do have both FSH and LH-like activity with higher degree of FSH-like activity. So it is secreted by endometrial cups in the equine's uterus, and endometrial cups are formed about 40 of pregnancy and persist until day 85. So means it's almost after 1 month of pregnancy to up to 3 months of it. So we do have second HCG. HCG, the one that are high peaks during first trimester of pregnancy, during 1 to 3 months of it. So it is a glycoprotein with alpha and beta subunits, and it also both activity of FSH and LH activity, but the predominant state is the LH action, and it can produce chorionic villi. Okay, chorionic villi, that's why the name is chorionic. Okay, so the chorionic villi is forming the placenta in the primates, and it can be detected as day 8, means after pregnancy of after 8 days. So it directly can be detected because at day of 7, the implantation are occur. So the one who are replacing the FSH and LH activity, the hormone that regulates the uterus is HCG. Okay, so it converts the corpus luteum of menstrual cycle to the corpus luteum of pregnancy. Now the function is also the corpus luteum, but the cycle is now converted into the corpus luteum of pregnancy. So we do have the development of conceptus. We do have divided into 3 equal periods, means the one who are trying to open bookkeeping, what we call at the clinic and so on, they are divided them into 3 trimester. Okay, trimester, 3 period of times. Okay, for the first trimester is called of months of 1 to 3. Second trimester for a month of 4 to 6, and the third trimester from 7 to 9. So the fetal growth from 8 to 40 weeks, and from this trimester, for example, for the first trimester, they are also divided into 3 weeks, from week 1 to 4, 5 to 8, 9 to 13, and so on and so forth until the weeks of 40 and 40 plus. Okay, so what happened here? You can see doctor will check the development of the fetus, the development of the embryo fetus, and then going to be a baby. So what are those developments should be? Okay. And then we can see from the starting from the zygote only, and then it's developed into embryo, and then after that, in week 8, in week 9 to week 38, it's now developed into fetal. Means they are having likely approximately a complete set of organ. Okay, so you can see from the one who are having a full developed organ is from week 20 up to 36. You do have central nervous system, or heart, arms, eyes, and the one who are having a complete section there. So there are also some of the harmful agents that can give certain effects and defects to the organ and structure of the baby or to the fetus itself. Okay, so we go one by one, the timeline for development of embryo, starting from gestation of pregnancy. For the first trimester, the organogenesis are what we call as for the first trimester. Okay, then we do have fetus. We call it as at week of 8 for the first trimester is what we call as embryo. Okay. Then after week 8, it's called as fetus. And then the HCG hormone are produced during this embryonic development timeline, so that the menstruation can be override and can have a pregnancy test detection. Then after that, we will learn about parturition, how it is happen when someone want to giving birth, and what's happened during the labor, and also the lactation. So these are all those timeline for the healthcare want to what we call as want to pantau ataupun have a close give an attention for this development timeline, starting from gestation itself, and then they are directly going to the first trimester, to the fetus development, partition, and the lactation process. Biasanya di klinik kesihatan and so on, we'll directly check it through this timeline. Okay. This is the same from the V line, the second trimester, we do have from which week? 0 to 12 week, we call as first trimester, second trimester from 13 to 28 weeks, and the third trimester from weeks of 29 to weeks of 40. Go for the first trimester. Okay, you see how's the development starting from week 5, week 7, you can see formation of eyes and a visible eye lobes during the week 9, and then you can see a basic facial features in this for the first trimester. You can see all those legs, the hands, the mouth already there. Okay, so this is the development during first trimester. So the first trimester is the main period of organogenesis, and the body structure begin to differentiate. So from week 9, it's begin to differentiate into central nervous systems, organs. Okay, so how's the brain are developed from this part? Okay, from the how's the face are developed and so on. So that's what we call as to differentiate. From second to fourth week, the embryo obtain nutrients directly from endometrium. If the embryo split during the first month, you can got it as identical twins. Then development into fetus, most of the major organ system present. During 4th to 6th week, the external body part development. Okay, external body part means the eyes, the ears, the hand, the feet, and so on. You can see at the back. Okay, so this one, heart begin to beat during the 4th week. So now we can scan whether scan for the heartbeat of the baby. So it can be detected for the at the 8th to 10th week of it. And then during organogenesis, embryo is more susceptible to damage. So for example, radiation, drug birth defect, and so on. So that's why we do have this kind of harmful agents that can directly cause a defect to the baby itself. Okay. So if it is in purple in color, the agent can give a major birth defects to the organ. If it is in yellow or orange in color, it can cause a minor birth defects to the baby. Okay. So this is how the identical twins are developed if they are split into two during the first month of mitosis for the embryo. Single cell are fertilized by single sperm and splits into two. If it is separate egg, so fertilized by separate sperm, so it's what we call as dizygotic twins, or what we call as fraternal twins, and share only about half of their gene. Okay, so after first trimester, on the 9th week, all the organ system are formed. Embryo now are called fetus. At the 7th week, we can see all of those internal organs are formed, such as liver, lung, pancreas, kidney, and intestine. But the function is so limited. At the end, it's just only formation of it, not the function of it. Not the function, but the formation. At the end of 12th week, okay, the fetus itself can be 10 cm long, means directly, and then the weight is about only 19 grams only. Okay, during the second trimester, okay, means from 4 to 6 months, right? Quickening occurs, women becomes aware of fetal movements like kicking, moving, and so on. And fetal heart can be detected here. Fetus open its eyes and fetus close about 30 cm in length, means triple times from this first trimester. Okay, then we do have on the third trimester, the skin is wrinkled, covered with down-like hair, means the hair structure, all those hair on top of the head and so on are now cover the baby's body, and then fetus turns to uterus to assume a head down position. So this one is complete cycle. It's ready to be delivered, and fetus experience a very rapid growth there. So what are happening to the mother itself? The mother itself, how she feels during this first trimester of of the mom is the mom herself. Okay, kita akan ada sama ada is it physical changes or physiological changes, two types of it. Okay, for the first physical changes, it increase in the level of hormones. Breast will be swelled and development of mammary glands very well. So she feels like need to urinate frequently, and morning sickness, vagina discharge may be increasing, and feelings of fatigue and sleepiness, very sleepy, because they do have a lot of energy to form all those babies in the first trimester. If for the physiological changes at the GIT, what we call as gastrointestinal system, the morning sickness is common because the elevation of the progesterone hormone, the heartburn means it's like want to the heartburn, right? It's like common because the organ is crowding by the fetus, means something cramping it, and then it's constipation because of the declining motility of the digestive tract. And then for the cardiovascular system, water body are rising, blood volume will be increasing from 25 to 40%. Blood pressure and blood pulses also increase, and the varicose veins are common. This is what we call as the varicose veins. The veins can be in green in color, can be clearly seen through the leg of a mother. And then for the urinary system, they do have additional burden and produce more urine. That's why they are frequently urinate. That's why we have need to urinate. Okay, so that's why. And uterus can also compress the bladder. That's why they are frequently urinated. Then we do have the second trimester from 4 to 6 months. Okay, during this, the morning sickness already disappears. Not means majority are disappearing the morning sickness during this 4 to 6 semester. But still, constipation and nosebleeds sometimes can occur. And then the edema means all those organs, external organs like the legs can has edema, means like it's bigger in shape because the water retention and because the swelling of the feet and so on. Colostrum may come out from the nipple, the one who which are white in discharge. White discharge of colostrum came out from the nipple, and psychological well-being is better among women who have social support, and then some of them are having a depression if they are not well supported during this time. Okay. Then we do have the same thing. What are the anatomical changes? Enlargement of the uterus. Lumbar curvature means the lumbar will become more curved in shape. It's not like the one who are single or not pregnant. So relaxation of pelvic ligament and here pelvic ligament and the pubic and symphysis due to production of relaxins. Then we do have the physical changes, presence of HCG, men's period. The implantation bleeding can occur during the 3rd or 4th week after last menstruation period. This may occur. Increased basal body temperature, and that's why the one who are pregnant will feel hot. That means the body temperature increase over 2 weeks after ovulation. We do have metabolic changes from the protein and carbohydrate. So these are all the stages. Okay, starting from the mother itself, the mother, we do have three partition, whether it's for the first trimester, second and third trimester. For the fetal development from the trimester, it's starting from the germinal stage, embryonic stage, and fetal stage. And there are also the signs and symptoms. Okay, those signs and symptoms are regulated by the hormones, okay, weight gain and belly growth, and the symptoms are present period, morning sickness, mood swing, swollen feet, and back. Then we go on. Once the complete of pregnancy should be parturition, what we call as labor. They are the process physiology. The pregnant uterus delivers the fetus or maternal organism. So there are 3 main stages. First one, the cervix will dilate, mean all of them will try to dilate, to open all those blood vessels, what we call as cervical dilation. Second one, the delivery of the baby. And then third one, the delivery of placenta. Okay, most of us are only considered for the delivery of baby. If the placenta cannot be delivered, so it can cause death also to the mother. So it should be complete in 3 stages of labor. Okay. Okay, so the dilation of the cervix, we can see how's the opening there. Okay, it start to open from 1 cm up to 10 cm in dilation number. And then second stage, delivery, and then third stage, the placenta should be delivered by the mother. Okay. We will see the illustration. How's the dilation of the stage 1? Okay, the cervix now are trying to open, and the vagina also trying to open up the morphology itself. And then at the stage 2, the crowning of the head to deliver the baby are ready to be delivered. And then at stage 4, the placenta should be delivered. Okay, and all of those umbilical clamp and so on should be delivered by the mother. Okay. So what is parturition? Parturition is labor, a series of events that expel the infant from the uterus, means ready to be delivered. Okay, why? Because of the regulation of this hormone. Which hormone? Okay, first one, the estrogen. Estrogen level will rise very at the peak. Okay, and then from this estrogen from the ovary, it can induce oxytocin receptors on uterus. Okay, so uterus itself do have a lot of receptor. Okay, so oxytocin receptor are activated on the uterus. So the uterine contraction begin, placenta release prostaglandin, and oxytocin also released by the pituitary of the brain. So means it's not only estrogen, it also prostaglandin and oxytocin hormone are involved. Combination of these three hormones, three main hormone major is inducing contraction. So the oxytocin from the brain, okay, from fetus also can stimulate uterus contraction, also stimulate placenta to produce prostaglandin, and this one, 1, 2, 3, can stimulate the vigorous contraction. It's like a very, 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 like want to die, the contraction. And this one, in order to expel the infant from the uterus itself. So the hormones and birth. Okay, so you going back, how long the time is almost 38 to 40 weeks. And then parturition is initiated by the prostaglandin in the human. Okay, prostaglandin are released by the placenta. Okay, placenta, once it's matured, they produce prostaglandin. And then estrogen increase, stimulate formation gap for the uterine muscles, as well as oxytocin receptor formed in the uterus. And this one can cause the uterine wall to contract strongly. Also, oxytocin can stimulate this prostaglandin production, which also powerfully stimulate uterine muscle contraction, and also the placenta release corticotropin-like hormone that cause more estrogen release. So basically, there are 1, 2, 3 main hormone that can initiate or regulate the birth of a baby. So estrogen from ovaries induce oxytocin receptor on the uterus, oxytocin from the fetus and mother's posterior pituitary of the brain can stimulate the uterus to contract and stimulate also placenta to make more prostaglandin, and from there it stimulates more vigorous contraction of the uterus and give positive feedback, try to produce prostaglandin again, stimulate the contraction again. And this one is try to produce prostaglandin again, stimulate the contraction again, and it's give a positive feedback to the oxytocin also to produce more and more until it's, the baby are expelled out from the uterus. Okay, so the beginning of labor are starting what we call as bloody show Then the amniotic sac is ruptured. That's why the vagina discharge are there. The amnion fluid are going down through the vagina, and then progesterone withdrawal theory. How's the initiation of the labor? Baby will move deeper into mother's birth canals, means it try to going down very well to the mother's birth canal. And receptors in the cervix of uterus are now excited and lead, the afferent impulse of a mother give the impulse to expel the baby to the hypothalamus. So hypothalamus integrate that information. This one, hypothalamus in the brain. The integration of this information sends the efferent impulse to posterior pituitary. So the posterior pituitary there, posterior pituitary, release oxytocin. Release oxytocin. So oxytocin are released to the blood. This target the mother's uterine muscle, and uterus respond to contract more vigorously. So oxytocin hormone are, because of this stimulation by the afferent impulse of the hypothalamus. We do have stages of labor parturition. Stage 1, stage 2, and stage 3, what we have discussed before. During the first stage of labor, you can see regular contraction because of those hormones and so on. And then effacement means shortening and thickening of the cervix. Dilation occur of the cervix and divided into three openings. First one, 0 to 5 cm. Late first stage, 5 to 8, and then transition phase from 8 to 10. So this one what we call as ready state, ready to expel the baby. Second stage of delivery is begin when cervix is fully dilated. So we can see the opening there, fully dilated. Urge to push or bear down, and crowning means crown means the baby's heads are visible. Episiotomy may be formed. Surgical incision of perineum means some of incision. Doctor will cut some part of it to enlarge the vagina and to facilitate the delivery, and baby will be born. So the expulsion occur whereby the infant will pass via the cervix and vagina. So the normal delivery is considered when the head first going out and fetus delivered by powerful contraction. That's why we call it very, very blood, powerful contraction of the uterine muscle. Umbilicus is squeezed and cut off by the physician. Means tali pusat akan dipotong. Okay. Then the third stage, expulsion of placenta, is the delivery of the placenta. They will inject the mother with oxytocin sometimes, but also sometimes, but usually it's directly, automatically can deliver this placenta. So this can cause powerful contraction again. So this one is from external stimulus, oxytocin. To expel the placenta, merely pull the placenta membranes out. Okay, there are also some of the complications for some of those who are giving birth. For example, transverse positions means the baby heads are not at the part of the cervix. Placenta abruption means the placenta itself abrupt. Placenta previa, it means the placenta is not matured enough and it's remained in its level. And then breech presentation, all those umbilical cord are coiling over the baby. Breech presentation. Okay, you can see some part of it is placenta previa. Normal placenta is directly the placenta previa means it try to close the cervix of the baby. Okay, it's try to what we call menghalang lah this baby from delivered because of this placenta. It should be normally on top of this uterus, but from here, because of the placenta previa, it's directly try to menghalang this baby from keluar daripada cervix. So what we call as the placenta previa. Then we do have umbilical cord prolapse. Okay, so the umbilical cord dropping alongside the baby but may not be seen in advance, and sometimes the umbilical cord before the baby's head are coming out, so the baby can be lemas lah sebab this umbilical cord berlingkar pada baby. Okay, that's why we do have cesarean section. Caesar means they want to deliver by an incision in the abdomen. This one, because some of the C-section, because baby too large, cervix not dilate, umbilical cord prolapse, what we discussed before, excessive bleeding, and placenta previa, the one who have been what we call as dihalang lah daripada keluar. So this one we call as C-section. And we do have lactation phase after that because of the oxytocin. Oxytocin are released, so it ejects some of the milk. Okay, and then it provides milk to nurse the infant. Lactation, enlargement of mammary and glands consists of glands. There are a lot of ducts and lobes that contain glandular alveoli. Okay, so most of them are to produce milk in a very high volume. And then we do have prolactin milk production, stimulates milk production, and oxytocin, both of them are hormones to stimulate the breast to eject milk. So that's why the mother shouldn't be stressed. If they are stressed, it can affect the brain of a mother. So the oxytocin cannot be cannot be normally produced. So it can affect the milk ejection by the oxytocin. So that's all from this chapter. See you again on the next chapter. Assalamualaikum warahmatullahi wabarakatuh.